Good morning to everyone. I'm Dr. Sumi MS. The topic of my today's presentation is Nanobots from Unit 5 Applications of Nanomaterials in Nanotechnology. On completion, the students will be able to explain the medical applications of nanobots and also describe the working of nanobots and understand the challenges and risks of nanobots. Nanobots. These are incredibly small nanoscale robots that are designed to perform specific tasks within the human body or other related environments with significant potential applications in the field of medicine for targeted drug delivery, cancer diagnosis and treatment, and also tissue repair. These self-propelled or remotely controlled machines can interact with cells, carry payloads like drugs or some genetic materials into the cells, and also perform functions like diagnosis, therapy, and precise surgery. While still an emerging field, these nanorobots are a revolutionary technology that promises advanced medical treatments by overcoming the limitations of the current approaches. Although these challenges present in that remain in the control and safe implementation. Size. The nanobots are machines with components on the nanoscale range, often measured in nanometers. Function. They are designed to perform some specific, often repetitive tasks with high accuracy at the molecular or cellular level. Interdisciplinary field. They represent an emerging field of technology that blends the fields of robotics, nanotechnology, as well as material science. Targeted drug delivery. Nanobots can deliver drugs directly to diseased sites, enhancing its efficacy and minimizing side effects by precisely targeting the damaged cells or tissues. Cancer diagnosis and treatment. They can identify and destroy cancer cells and are explored for precision therapies such as hyperthermia. Tissue repair. Nanobots show potential for repairing damaged DNA, spinal cords, and other issues at the cellular level. Surgery. They are also involved in performing precision operations at the cellular or even subcellular level, making minimally invasive interventions possible. Nanobots are also used for targeted therapies such as delivering drugs directly to the infected or cancer cells, clearing the artery blockages as well as repairing DNA. They also serve as diagnostic tools acting like artificial blood cells to detect infections or changes in the glucose levels in diabetes patients. Nanobots can identify and remove blockages in arteries. This process helps treat most of the cardiovascular diseases. Nanobots are also designed as microbeavers which actively clear pathogen as well as bacteria from the body, potentially combating infections and thereby increasing the immunity of the body. Other applications include performing precision surgery at cellular level and thereby enhancing the immune system. Other potential applications include environmental cleaning as well as space exploration. In environmental cleaning, the nanobots are employed in such a way that they are being used in sensors that can detect chemical as well as biological agents in air and soil. And in space exploration, the small size of nanobots could make them useful for exploring challenging environments in space, such as collecting samples and also conducting research in other planets. Working of nanobots. Propulsion. Medical nanobots can utilize external power sources like magnetic fields, ultrasound, or light or internal energy conversion systems to make them move. Sensing and control. These nanobots are equipped with systems to sense their environment and can be controlled externally, allowing for targeted actions and a high degree of command. Payload delivery. They carry and release the payloads, which include drugs, genes, or sensing molecules to specific locations within the body. Challenges being noted. Manufacturing complexity. Creating these nanoscale machines is extremely challenging with theoretical concepts like nanofactories envisioning atom by atom assembly, control and safety. Ensuring complete control and preventing any negative effects from nanobot replication or activity is a significant concern that requires careful management. And despite these challenges, this nanorobotics is also considered to be as a promising field with significant future prospects in revolutionizing medicine through targeted, precise treatments. What are the risks generally faced by nanobots? The two main potential hazards related to nanobots at early stage are the use of conventional hazards such as hazardous materials and UV light, and the loss of propulsion and navigation control. Quiz questions on nanobots. What do you mean by nanobots? Discuss briefly the medical applications of nanobots. What are the challenges faced by nanobots? Thank you.